For today's House Call, we're joined by Dr. Keith Bachmann from UVA Medical Center to talk about what can be a painful and debilitating back problem. I remember these tests from growing up in schools. You always got tested for scoliosis. Let's start with kind of a brief explanation of it.
Sure. Thanks for having me tonight. Scoliosis can come from a lot of different reasons, but it's a curvature in the spine. So your spine's connected to your skull, it's connected to your pelvis. In between, it can curve out of plane. That happens for a lot of reasons. Depending on your age range, it could be degenerative, it could be idiopathic, which is the school screening test that you were talking about.
And is that something you mentioned, different causes? Are there causes that we kind of want to be aware of and look out for that we can maybe control?
So the idiopathic, the school screening, really looks for, and the pediatricians look for that. And that's something that as a child is growing, that curve might get worse. And so that's something that we want to try to control so that they don't get to a point where they're needing surgical intervention.
Sure, so let's get to the control and treatments. What can we do so we don't get to that surgery option?
So early on, it's knowing that you have a curve and being able to monitor that with x-rays. If it gets to a big enough number, then it's a brace that can help to control that curve as the child grows. And then if they do get to a big enough number where we think that curve would become a problem in adulthood, then we would talk about addressing it with a surgery.
So scoliosis is one of the things we hear a lot about. How common is that in kids, and as you mentioned, as you kind of increase in age?
Relatively uncommon in kids. About 1 in 1,000 will have a scoliosis, but only a small percentage of that would go on to need bracing or surgery. As we go on and get into older age, that number stays relatively consistent, with more of it being treated surgically, as those can be caused by degenerative changes and loss of that postural support over time.
All right, so we keep an eye on things. UVA Orthopedics obviously is kind of, I don't want to say the last resort as a slight to them, but you hope not to get to that point.
Sure.
What if you do get to that point?
Well, if you get to that point, you come and you see our team. We've got a great team of providers, whether it's non-operative care, doing that initial monitoring, getting you into a brace, or certainly the expertise from a surgical standpoint to treat it if it gets to a surgical point.
All right, Dr. Keith Bachmann, appreciate your time this evening.
Thank you very much.
Thank you.